Hello, I am Thoudam Karles. I am a fourth-year medical student. Today, I am going to perform Leopold'S maneuver and breast examination. Let's first start with Leopold'S maneuver. First, we need to introduce ourselves to the patient and ask the patient's names and other details to verify the patient's. Ask for the patient's consent before doing the examination. We also need to wash our hand before the examination. We shouldn't forget to keep the examination room privacy for the patient. And also ask the patient to empty her bladder before the examination so that there will be no discomfort during the examination. Allow the pregnant woman to lay in supine position and slightly flex knee, and also put a pillow below her head to make the patient laying comfortably. For the first maneuver or fundal grip, we will be assessing the fetal presentation or fetal leg. So we are going to assessing whether it is a breast or cephalic. If it's a breast, it will be hard, round, and movable. But if it's cephalic, it will be soft and nodular. Before assessing it, we need to warm our hand to avoid sudden stimulations to the mother while we touch her abdomen. We should be passing towards the mother's face and forming a triangle. We should palpate around the uterine fundus to find out whether it is breast or cephalic. For the second maneuver or umbilical grip, we are going to find the fetal's back, as we need to know where can we auscultate our Doppler for the measurement of fetal heart tone. So I will keep one hand at stationary position and palpate with the other hand. From top to bottom and vice versa. The fetal back will be smooth, firm and resistant surface, but for the extremities, it will be irregular and angular nodulations. For the third maneuver or Paulus grips, we will be grasping with thumb and finger of one hand, forming a L shape on the lower position of the maternal abdomen, just above the symphysis pubis. If the presenting part is not engaged, it will be movable mass, and usually it's the head. The differentiation between the head and breast is made as in the first maneuver. For the fourth or last maneuver, that is pelvic grip, we should be facing towards the mother's feet. Others trees are facing towards the mother's face. For this maneuver, we are facing the mother's feet. And we are going to assess the flexion, like the degree of flexion. We should be palpate by using both hands above, like 2 inches above the inguinal ligament, like forming like a triangle shape like this, and like palpate like here. Remember, a well-flexed head is right opposite to the back. After the examination, make sure your patient is in comfortable position, and also don't forget to wash your hand. Thank you. Now we are going to perform breast examination. First, introduce yourself to the patient and ask the patient's name and other details to verify the patient. Make sure to ask for the patient consent before the examination. Firstly, inspection. Adequate inspection requires full exposure of the cyst. Inspect the breast and nipple while the patient is in sitting position. First, inspect when the arms are at the side. Inspect for the general appearance, including color of the skin, size and symmetry of the breast, and characteristic of the nipple, including size and shape. Next, inspect when the arms are over the head to bring out dimpling or retraction. that may otherwise be invisible. Ask the patient to raise her hand over the head and then press her hand against her rib to contract pectoral muscles. Inspect the breast contour carefully in its position when the breasts are large and pendulous. It may be useful to have the patient lean forward, supported by the chair or examiner head. Now, palpation. Palpation are best performed when the breast tissue is flattened and the patient is in supine position. Use the pad of second, third, and fourth fingers, keeping the fingers slightly flexed. It is important to be systematic. The vertical strip pattern is currently the best method for determining breast masses. Let's first start with the palpation of the lateral portion. To examine it, ask the patient to roll on the opposite side of the hip and placing her hand on the forehead but keeping her shoulder pressed against the bed or the examining table. This flattens the breast tissue. Now begin palpation in the axilla, moving in a straight line down the bra line, and then moves the finger medially and palpate in the vertical strip up to the base of the clavicle. Continue in a vertical overlapping strip until it reaches nipple. And follow the same similar step on the other side of the breast. Now, palpation of the medial portion of the breast. To examine the medial portion of the breast, ask the patient to lie with her shoulder flat against the bed or examining table, placing her hand at her neck and lifting her elbow, which is even with her shoulder. Palpate in a straight line down the lip line, then back to the clavicle. Continue in a overlapping vertical strip to the mid-sternum. Follow the similar step procedure for the other side of the breast also. Palpate its nipple, noting its elasticity. If there is history of nipple discharge, try to determine its origin by compressing the areola with your index finger and place in a radial portion around the nipple. Watch for discharge expressed from any dug opening of the surface, not color, consistency, quantity of any discharge, and the exact location where it appears. Thank you.